and welcome to the Fibco Virtual Community Health Fair, Matters of Health in Black and Brown. Thank you for clicking in to join us. My name is Ernie Eckhart, Chairman of the Board of Directors of Fibco Family Services, Inc. And we are hosting and producing this community event with the support of some community partners and sponsors.
My name is Chiquita Taylor, and I am honored to be the Executive Director of Fibco Family Services. Fibco was founded in 1986 by Dr. Warren H. Stewart Sr. to be the community outreach arm of First Institutional Baptist Church, where he serves as senior pastor. As an independent 501c3 nonprofit community-based organization, Fibco has a legacy of serving the underserved of the Phoenix metro area. We strive to have an empowering impact on individuals and families and their needs in areas such as food, clothing, housing, employment skills training, immigration assistance, and lately in health and healthcare. Our mission is to provide people with knowledge, skills, and support to transform and empower their lives. To learn more about our programs, please visit us at fibco.org, or you can visit us on Facebook or Instagram at Fibco Family Services, Inc. This 2021 Virtual Community Health Fair is focused on providing people with knowledge, skills, and support to transform their lives into healthier ones for their future. In spite of trying to live through the worst public health crisis since the early 20th century, in fact, we are compelled to offer this event now because of the connections or impact of COVID-19 to top health challenge areas in the Black and Brown communities. We are very pleased and honored to present this event of access and resources to the community now, because it is needed now. Now is the time to address issues of disparities, disproportionate impact, access, and solutions. With a short event such as the health fair, we take a small step in trying to address this need at the foundational level with access to resources and information and education. Expect more Fibco health programs and initiatives to follow as we work with our partners to meet the needs of the community.
Now, this fair was designed with a focus on the social determinants of health, particularly in the Black and Brown communities. So as you look through the agenda with the sessions and speakers, you will see a diversity of speakers addressing issues of housing, mental health, diabetes, insurance access, cancer, financial empowerment, to name a few. Over the 3 days, there are approximately 29 speakers covering 20 topics that top the list of community health challenges, including, but certainly not limited to, COVID-19. Some sessions are live, and you will be able to chat with most of the speakers. Some presentations of material are available in Spanish and English. You will also be able to go to the Hope and Help resource room and find documents or links to more empowering information. And you can access these services and resources that are available to you in the metro area. The virtual fair is designed to be user-friendly and efficient as you navigate through the site to find and enjoy whatever you register for during the 12 hours of content spread over Thursday, Friday, and Saturday. I do want to thank our sponsors, APS, HE Still University, Banner Health, Dr. Donald and Effie Godbold, First Institutional Baptist Church, Mayo Clinic, Mercy Care, Russ Lyons South Beach International, SRP, United Healthcare, as well as other partners who made this event possible. So we invite you to join in wherever you have an interest. And please don't forget, before you leave, to give us feedback so we know how to improve for the future. I thank you and enjoy the fair.
And don't forget, you can also contact us at fibcoadmin.org or chiquita.taylor@fibco.org. Thank you again for coming, and please do enjoy what we have prepared for you. Be well and be safe.
I'm Phoenix Mayor Kate Gallego, and I'm honored to be with Fibco Family Services for this 3-day virtual health fair. This year's theme, Matters of Health in Black and Brown Communities, could not be more important or more timely. COVID-19 and the events of the past year have revealed what you already knew, that there are huge gaps and huge opportunities, and that we need to do better. This event to me is full of optimism and setting us on that path to making sure everyone has access to health information, health services, that we put equity and equality at the forefront. Thank you to the Fibco family for meeting such important and vital community needs. I also want to thank the amazing partners that we have in this event, ranging from Mayo to Valleywise to Banner, service providers including SRP and APS, as well as insurance providers such as United Healthcare. We appreciate your partnership. I hope this event will be a great chance to engage, to learn, and to share what you already know. Also want to thank Fibco and Dr. Warren Stewart for your leadership over the past year on so many issues, including most recently vaccination. Thank you, Dr. Stewart, for rolling up your sleeves and getting vaccinated in public. I did that with my flu shot, and it's a funny experience, but your leadership is a role model for so many in this community, and vaccination is going to be such a key step to moving forward and getting to that day where we can each safely take off those masks and know that our community is okay. The City of Phoenix, we hope to be your partner moving forward, including at our mobile vaccination sites, as well as the static site at Maryville Community Center, and just work with you on so many issues. We've been glad to partner on nutrition, hunger, safer, healthier Phoenix, but we know we have a lot more work to do. With the momentum coming out of this event, I'm optimistic we will get it done. Have a great experience. Thank you.
And medicine intersection. You can be doing fine, going through life well, and all of a sudden you get a doctor's diagnosis, you get sick, something happens, and you are wondering, well, how can this happen? I've been trying to live right. I have faith in God and everything is going well. So how am I at this point having to go see a doctor, having to have all of these tests, may have to have surgery, et cetera, et cetera. So this is a very pertinent conversation that we are having on this day. And the very fact that Fibco Family Services is having this conversation is evidence, that concrete evidence, that there is an intersection between faith and medicine. There should not be a wall between the two, faith and medicine. And so it is my privilege to have this opportunity to chat with you about that. But to begin on a lighter note, we are praying. There is a 73-second video that I want you to view and hear right now. Renette, if you can put that video on, I'd appreciate that.
Is way up. I want you to touch your neighbor right now. I need some musicians. Act like we're about to start something. I want you to just touch your neighbor right now. And I want you to, y'all not touching your neighbor. I don't see enough people doing it. Touch your neighbor right now. And say, neighbor. Tell them, say, oh, neighbor. Look at him and say, neighbor. Oh, neighbor. Look at him right now in the eye and say, don't touch me no more. Go on and tell him this. You ever been in church and somebody just keep touching you? Cause the pastor keeps saying, "Hey, touch your neighbor and tell him this, touch your neighbor and tell him that." Too much touching going on sometimes. And you know what? I watch people when I go to the bathroom, and not everybody have the ministry of washing hands with soap and water. They do whatever they do there and then walk right out the bathroom without even looking in the direction of the soap and the water. Look at somebody and say, "Don't do that. Don't touch them, though. Don't touch them." That's wonderful. I love going to church.
All right, I hope you got a laugh out of that. That is Roderick Price. He's been here for us. He is a Christian comedian, and he did a piece off of touching your neighbor, and then someone being in the bathroom, not touching the handle to wash themselves, to wash their hand and going back in worship. Well, that deals with the intersection of faith and health. Yes, we should have faith, and we should do as much as we can. If the preacher says touch your neighbor and say high five and all that kind of stuff. But when it comes to washing your hands, that is a ministry that all of us should do, especially after we go to the restroom. So I thought I would just start with that right there. And that leads into what I want to talk about, FIBC. Since last March, the end of last March, we're coming on the anniversary of this COVID-19 pandemic. We have had to have an intersection of faith and medicine in order to establish protocols for us to be able to have in-person worship services. That's what we've had to do. And we call it here at FIBC, holy and healthy, sanitary, sensitive environment. We have done everything we could in light of COVID-19 and the fact that it is an airborne virus that is injurious as well as deadly. We no longer have in-person worship services at this time because the positivity rates began to get high here in Arizona, very high, up 25, 24%. But even before that, for 3 months, we had in-person worship services, and people were had their temperatures taken as they came to worship, and they actually RSVP'd before they came to worship. And then once they got there, they had their temperatures taken. They were required to wear masks. We have the sanctuary set off where everyone is at least 6 feet from the other people, and every other row seating. And between worship services, and actually in worship services, between the praise and worship team and me preaching, all of that is, what's the word I want to say, defumigated, but we spray to clear the air between worship services and when I get up to preach, and everybody has his or her own microphone. So that is just an example of how faith and medicine interact. We had our regathering task force meeting last night to talk about when will we regather. We established a positivity rate range that when the cases go down, then we will reopen the worship services. And so we established protocols like that for going back into in-person worships. So I was listening to radio on February the 12th, and KJZZ, and they have a program called The Show from 9 a.m. to 10 a.m. And believe it or not, one of the segments dealt with what does God actually do? And it was a session dealing with science and religion, which is very, very similar and includes medicine, the intersection of faith and medicine. And they talked about the clashes that we see in secular society between religion and science, and can the two coexist? But what the experts said on the radio was that wasn't always the case, where science and religion were at odds with one another. They both respected and were informed of what each other can do as it relates to faith and medicine, faith and science. So I wanted to share that with you at this time. Let's hear what some of the scholars have to say. Well, yes, excuse me. Let's move to a sampling of what the Bible, I always like to begin with the Bible, what the Bible has to say about religion and faith and medicine, faith and the medicine intersection. There's a story, 2 Kings 20:1-11. I won't read it for you, but it's a story where King Hezekiah of Judah became sick unto death. The prophet Isaiah went to his royal palace and said, the Lord has said, Hezekiah, get your house in order. You're getting ready to die. Well, Hezekiah, according to the scriptures, Hezekiah wept bitterly and he didn't appreciate the death notice. And so he went to the Lord in prayer and he said, Lord, you know I've been faithful. You know what I've done. You know I've tried to obey all of the commands of the Torah, of the law of Moses. So please, can you do something? And the story goes, as Isaiah was leaving the king's palace, the Lord spoke to him again and said, go back and tell Hezekiah, I have heard his prayer and I am going to heal him. I'm going to give him 15 more years of life. And he even asked for confirmation. Hezekiah asked for confirmation that God was going to heal him, and God gave him confirmation. So that's a biblical story of faith and medicine, faith and sickness. The king was going to die. He prayed to the Lord spared him. Jesus Christ in Matthew 4:23 and 9:12 talks about, in the first passage, what his primary mission was. And I preached about this a few weeks ago for FIBC. The three priorities of Jesus's ministry were teaching, preaching, and healing while he was in the flesh. Teaching, preaching, and healing. So again, a connection between faith and medicine, between faith and sickness. They had doctors in those days, and there are several stories. I know you may remember the story about the woman with the issue of blood who had spent all of her money on the doctors and was still had the malady she had, but she touched the hem of Jesus' garment and she was made whole. So faith and medicine intersection. Also in Matthew 9:12, Jesus responding to some people about something that had happened, and he said, the well do not need a physician, but those who are sick need a physician. He was being challenged by the Pharisees for healing someone on the Sabbath, and he said, those who are well don't need a doctor, but those who are sick do. And then in James 5:14 and 15, which is, and by the way, those who may not know, James was the half brother of Jesus Christ. And so James was writing a letter to the church after Christ had already been resurrected. And James wrote about the prayer of faith. And I want to read verses 14 and 15. Are any among you sick? They should call for the elders of the church and have them pray over them, anointing them with oil in the name of the Lord. The prayer of faith will save the sick, and the Lord will raise them up. And anyone who has committed sins will be forgiven. So you have both in the Old and New Testament instances where there is the faith and medicine and sickness intercession. The Bible doesn't prohibit going to doctor. The Bible talks about drinking wine for the stomach's sake. In the Old Testament, there are various passages about people using herbs and using things from the ground that will make them well. So I just wanted to start there. So let's move to the next slide. So we've heard from the Bible But now I want to hear from some religious scholars, I want to hear from some medical scholars what they have to say about faith and medicine. The first quote is a quote from an article, Religion, Health, and Medicine in African Americans, Implications for Physicians by Dr. Levin, Dr. Chatters, and Dr. Taylor. Here's the quote, the first quote I have from them. First, observable differences in rates of morbidity and amid overall and cause-specific mortality exist across major categories of religious affiliation, with lower rates typically found among members of religions or denominations that make strict behavior demands. Now let me try to break that down. It was a medical article, and so what it is saying is that scientists, medical professionals have observed over the years that one's religious affiliation, one's expression of one's faith decreases the rate of death and the overall mortality when people get sick. And this particular quote notes religions, members of religions and denominations that make strict behavior demands. And they identified Seventh-day Adventists. They identified the Church of the Church of Jesus Christ of the Latter-day Saints. Religions and faiths that say you can't eat a certain thing, or you must eat a certain thing, or drink alcoholic beverages in moderation, that will help you to live longer. So science has proven faith and medicine go together. All right, go to the next slide. The same article says, second, higher levels of active religious participation or observance are associated on average with less illness and with better health, according to a variety of scales and indices. So again, what is being said is that if you have faith, and if you are active in your faith, in living out your faith, in fleshing your faith, that it has been proven that you will have less illness as an average, as a norm, than other people, and you will have better health. There's something about the faith and medicine, the faith and health intersection, that if you believe in God and you act upon your beliefs, it doesn't mean that you will not become sick, that you will not die of cancer, that you will not have a serious major illness, because virtually every one of us under the sound of my voice has been sick and have had some scares at one time and some major illnesses, even though we have been people of faith. But yet and still, our faith helps us, and it helps work with medicine. That's the point I want to make. All right, let's move to the next slide. There's another article here. All right, this article is from Spirituality and Health, the Development of a Field, by Dr. Puchowski, Dr. Blatt, Dr. Kogan, and Dr. Butler. Here's what they say about this matter of spirituality and health. Spirituality is an essential element of humanity. So these are medical doctors who confirm it's important that we realize we are spiritual beings. It goes on to say, spirituality has been foundational in healthcare for centuries, but became overshadowed by early 20th century technological advances in diagnosis and treatment. Now, here's how I interpret the latter statement. It says that there's been a long history, and I'll get into that a little bit later. There's been a long history about spirituality and healthcare working together. But something happened in the 20th century when you have, the scientific and medical and technological inventions and improvements in the way we deal with health, that this chasm, the intersection was blocked, or there's been attempts to block the intersection of faith and medicine. The Bible talks about being wiser but weaker. And so what I believe this article is saying by its writers is that we have left the intersection of health, of medicine and faith, and put it aside because we're so smart now. We have so many modern medical technological advances. Very great observation. Go to the next slide, please. All right, Exploring the Role of Faith by Trevor Bibler. And I believe this came from the Baylor University School of Medicine. And Baylor is a Baptist university in Texas that is known for its reputation, etc., of connecting both faith, scholarship, and medicine. Here's what Dr. Bibler said: medicine and spirituality have been closely linked throughout human history. Each of the world's three most popular monotheisms, Christianity, Islam, and Judaism, have a long history of explaining how sickness and disease happen and how medicine should be incorporated into faithful practice. So medical people and faith people are not at odds, should not be odds with one another. Both of these, all three of these monotheistic religions that believe in one God, that are connected, they all deal with sickness and disease and death, and how medicine should be involved in this whole process. So there again is a historic intersection between faith and medicine. Next slide. So I want to talk, as my time runs out, and there'll be hopefully a little bit of time for questions. I want to talk about FIBC on faith, on the faith and medicine intersection. We are blessed to have 9 chaplains who are members of FIBC. These are people who have been trained in seminary, as well as gone through all of the rigorous requirements it takes to be a chaplain. It's called the CPE program. And they've gone through all of that even after earning a Master of Divinity degree, which is a 3-year master's degree. They've gone through this, and most of them are hospital chaplains. They are paid by hospitals because hospitals know that there comes a point in the medical treatment that they give to patients that isn't enough. And so they provide the opportunity for people who have faith, and even these chaplains minister to people who may not have faith, but they are involved. And I believe FIBC is extremely blessed to have 9 certified chaplains who are members of this congregation. So again, I'm showing an example of faith and medicine intersection. Next point. The next point there, we have medical doctors and other health professionals as members of FIBC. They care for this. They are either doctors or nurses or administrators, but they don't see a disconnection between their faith and what they do professionally in the medical field. So I think that right there shows an example of the faith and medicine intersection. Next point. FIBC has been working ever since COVID-19, the COVID-19 pandemic affected and infected affected and are infected, all of us in one way or another. We've been working on sponsoring COVID-19 information, making sure our members understand what COVID-19 is, what it can do to you. We have been a testing site. We have been a testing site every Tuesday and Thursday. We have a testing agency for COVID that comes and sets up on our campus and provides testing for any and everybody. On February 3rd and on February 24th, faith leaders were asked by the Arizona Department of Health Services and the Governor's Office of Youth, Faith, and Family to publicly take vaccination shots. And thank God I got my second vaccination shot on Wednesday, have had no side effects whatsoever. But the government felt, the Department of Health felt that if faith leaders are seen taking the vaccination, it may persuade other people who might be on the fence or might be against taking it to take the vaccination shot. And then, of course, FIBC has provided financial assistance for people who the COVID pandemic has caused them to lose income. Next point. Personal examples of faith in medicine. I'm gonna go through this very quickly because I think I have about 5 to 10 more minutes. I'll never forget, as a teenager, a young preacher called to preach. I went to a revival one night at the First and Union Church of God in Christ, First Church of God in Christ in Coffeyville, Kansas. And there was a guest evangelist who called for a prayer line. Well, my grandmother, who was in her 60s at the time, I think just had turned 60, had been diagnosed with colon cancer. And she was home in the bed ill. So when I went to that revival, the evangelist called for the prayer line. I went up and stood, not for myself, but for my grandmother. When I got home, I went in her bedroom. I said, Mama, I said, I was at the revival and I stood for you. And I'll never get her response to me. Thank you, son. She said, I know God is going to heal me. He's already told me he's going to heal me. And I appreciate you standing in line for me. Well, end of the story. My grandmother lived for 12 more years. She did not die of cancer. She died of old age. I mean, she had congestive heart failure, which ran in her family, but she did not die of colon cancer. Faith and medicine intersection. Next point. Next bullet point, please. I have had vocal cord challenges over the years due to my profession of preaching the gospel. And back in 2014, I had a nodule that had developed on my vocal cords, and I could not preach without getting hoarse. And I actually burst a blood vessel preaching in Utah, and went to the doctor and all of that. I was on the operating table. My ENT surgeon was going to remove the polyp from my vocal cord. When I came out of recovery, my wife, Karen, and a couple of other people were all standing around me, and when I came out of it, I wanted to know why they were standing around me. And the doctor came in and said, I'm sorry, Mr. Stewart, I could not do your surgery. She said, I tried every way I could to get to the polyp, but I couldn't get it, and I did not want to injure you. In other words, she didn't want by just going after it, she didn't want to injure me or damage my vocal cords further by doing it. Well, to me, that was an answer to the prayers the church had prayed before I went into surgery. She had wisdom to not force the surgery and injure my vocal cords. All right, the next bullet point, and almost about 2 more minutes, I'll be done, open for questions. There's a member of our congregation who recently had an arterial blockage, and he was scheduled or preparing to have surgery. in order to move this blockage, and they were amazed that he had not had a stroke. And as he was preparing for the surgery, and they did a pre-op examination, they looked again at the medical document that showed that he had the blockage. But when they went back to look to get ready for surgery, the blockage was not there. Now, that member had been prayed for. The hands of an elder in the church were laid upon that member before he went to prepare for surgery, and the blockage was removed. Faith and medicine intersection. As we come to a conclusion, next slide. We have a definition around here at FIBC called it, faith is the trusting belief that our best future is in God's hand. And that is even when we are sick, even when we have been diagnosed with a terminal illness or with a major disease, when we don't get the optimistic report we would like. We have faith, the trust and belief that our best future is in God's hands. Next bullet, and I'm through. The conclusion I bring to this presentation, the faith and medicine intersection. God, more often than not, heals through medicine, most of the time in its normal practice, but sometimes miraculously. God, more often than not, heals through medicine, but most of the time in its normal practice, but sometimes miraculously. A person's faith, as well as the faith of others, and often of persons in medicine, confirms the faith and medicine intersection. I thank you very much for this opportunity. Are there any questions that anyone has for me?
All right, this is, we have a couple minutes for an opportunity for you to, if you have questions, you can submit them on chat, and I'll check. Person can read them out, the pastor can see them. All right, well, while you may be thinking, I want to personally thank Pastor Stewart for those words, very, very important ones about this intersection. I know I am often reminded that, our hospitals still have chaplaincy programs. And they mandate it. I mean, it's there. I mean, they let people know that, yep, we're going to do everything we're supposed to do. But this notion of your faith will probably get you that much further in terms of using the medicine.
There are two questions I see in the chat room. The first one says, what do you think about folks who use religion and faith as an excuse to not get the COVID vaccine? Well, one, it is their right. It is their right to believe that their faith or religion would not allow them to take the COVID vaccine. I mean, that is their right. Just as a person who is in medical care can refuse, can do the do not resuscitate order. They have the right to say, if I reach a certain point, of health deterioration, I don't want you to try to bring me back. So I would answer that question. Now, if they're using it as an excuse, then it's to their detriment. But if their faith or their religion says you should not be vaccinated, you should not allow any foreign medicine or any medicine that has a virus to enter your body, then they have that right, and then they suffer the consequences. All right, I'm going back. Okay, that's that question. The next question: have you had members express that their faith has been challenged during this season of COVID? Oh, yeah, you're listening to one. I mean, COVID-19 has challenged me. I mean, the first month was my worst. I am a hands-on pastor. I'm a touching, going back to Project Rice, touch your neighbor. I touch my members. And so when I was prohibited, especially when we had shelter in place, from touching people, from going to the hospital to see my sick members, but from going to houses. So I had a problem with that. But there have been other members who have been challenged. Why is this happening to me? Why, Lord? And one of my colleagues said that he's trying that he believed that God is trying to tell all of us something with COVID-19, and he hopes that we have the discernment to know what he's trying to tell us. Finally, the last question says, how are you reassuring people with health conditions that the vaccine is safe? I'm asking any and everyone to get all the information they can about the COVID-19 vaccine, about vaccines. There are actually more than one. And once you get that information in prayer, in faith, in wisdom, seeking counsel with your medical professionals, then you determine if you should go ahead and take the vaccine. I've talked to two of our members who are above 90, and I'm done. And they both have told me that they're not going to take the vaccine. And here's what they said to me. And it wasn't they're against it. They simply said that at 90 some years of age, they know they're going to eventually die from something. So they're staying at home. They're not going out. And they just said, well, Pastor, I heard you urging us to take the vaccine, but I have selected at 93 years old, I'm not going to take it. And I respect that. Thank you so much. This has been a wonderful opportunity. I hope I've been helpful.
Definitely. Thank you. Thank you very much, Dr. Stewart.